unsightly scars can make people feel self-conscious and affect their confidence, but there are solutions. We are joined by our friend, Dr. Kahn, who is a board-certified plastic surgeon and a leading expert when it comes to scars at Executive Plastic and Hand Surgery Center. And also with us is Juanita Weston, who is a patient who was helped by Dr. Kahn. Thank you both for being here. Thank you for sharing your story.
Thank you so much.
Thank you,
Good
first
morning.
of all. Good morning to you, Dr. Kahn. It's great to have you back. But I'm going to start with some before and after photos of Juanita, who suffered an injury in a car accident. So this is a before, and the injury is a scar on the left side of her face, and it seemed to get worse over time. And here is the scar after. Look at that. It's practically disappeared, which is amazing. So Juanita, tell us how Dr. Kahn helped you.
Dr. Kahn was absolutely amazing, Tati. I visited a physician from a university, and he told me that there was nothing that could be done other than some injections, and it would be kind of painful, but it wouldn't take away the scar. And there was no guarantee that it would even reduce the scar. So my case manager, Stacy Smith, she said, well, we don't have to go with that doctor, maybe we can find another one. So she found Dr. Kahn, and Dr. Kahn said, absolutely, I can help you. He said that you would have to go to some radiation, and we could do some revision, some scar revision, and you'll be okay. So we did the surgery, went back for some follow-up, did the radiation, and 2 years later, I look like this. Dr. Kahn gave me my self-confidence back, my self-worth back. You know, in a day and age where we do selfies and Instagram and everybody, you know, judges you by every little thing, every little imperfection, it was just so important that I got that self-worth back, and he gave it to me.
That is so wonderful. That is so wonderful. And it has healed beautifully. If you're not looking, you wouldn't even be able to see it.
Thank you so much.
Yeah, so Dr. Kahn, tell us why her scar healed the way that it did.
So the scar formation is the body's way of responding or healing to an injury. So first of all, the most important question to ask is what caused the scar? This was a high impact trauma from a car accident where this was a crush injury, and so what happened to the skin, it basically got crushed, and so it also got macerated. And also the other very important
What does
thing,
macerated mean?
macerated means it basically get crushed and essentially beat up, where there's a lot of force that basically causes the scar to heal in a disarray. And this is exactly what we see in Miss Weston. Now, the scar does not appreciate the boundaries. It grows out of its proportion, and as a result, it basically looks unsightly and ugly, and also very pruritic, which means it itches a lot. And last but not least, it's very unsightly. Now, if you look at the ethnic background of the patient, that's also very important to consider, because scars have a personality of their own. You have to be able to take care of a scar such that it does not come back, because essentially what I will be doing to Miss Weston would be traumatizing the skin and putting it together, and there is a very high likelihood. So as Miss Weston mentioned, we did go ahead and do 3 consecutive days of low-dose radiation. She went and sought the consultation from a radiation oncologist who I work very closely with. So the chances of recurrence were down to essentially 10%. So 90% chance that she was not going to have the recurrence.
That's awesome. So you laid out a whole plan for her, which is what you do for all of your patients.
Yes.
But now let's talk about some of these items here on the table that you may want to suggest to use or that you should never use. So let's go down the aisle and start with this.
So first we'll start off with peroxide. It's been shown that it cleans the wounds, but in reality it harms the wound rather than help it. Initially it may make the wound look good. Now we also have Sikacure. This is silicone sheets that we apply directly on top of the scars, and it also protects the skin and the scar itself, and also helps do the hydration, equilibrium, and also helps with the wound, the way it settles over a long period of time. One thing we have to know is that a scar takes basically 1 entire year to settle, and so we have all these tools and modalities in order to essentially give it the best outcome.
Okay, all right. So we're going to continue this conversation at 1 p.m. on our Live in the D Facebook page, where we'll continue the conversation, answer some common questions that people have about their scars, and hear more from Miss Weston. Thank you, Dr. Kahn, and we're going to continue this conversation 1 p.m. on the Live in the D Facebook page. And to schedule your appointment with Dr. Kahn and to learn more about his practice and services, visit the website executiveplasticsurgeon.com or call 734-419-1615. You can also learn more by going to YouTube and searching Kahn Plastic Surgery Academy. Thank you both again, and
Welcome.
we'll
Thank
see
you,
you
Ty.
on Facebook.
Great.
All right.